Good afternoon, everyone. Thank you so much for joining us today. We have a webinar today that is called Certificate 4 in Medical Practice, Assisting Scholarships for Future and Medical Practice Assistants. And this session is specifically aimed at the administration staff working in general practice. My name's Lisa. I'm a Flexible Project Officer from the Primary Health Network. Before we begin, I'd like to acknowledge the traditional custodians of the lands in which we all live and work on, and I'd like to pay respects to elders past, present and emerging, and extend that respect to any First Nations people joining us today. Just a couple of things to mention before we start. This session will be recorded, and throughout the presentation, if you have any questions, please pop them in the chat box. At the end of the presentation, there will be some time for Q&A. At the end of the session, I'll pop a link in there and a QR code for the evaluation for this event. Please feel free to complete it. It's not mandatory, but we do appreciate and welcome feedback for future education sessions. I'll hand over now to Alana and Kay from UNE Partnerships for more information on this opportunity. Thanks to you both for your time today.
Thank you so much, and good afternoon, everyone. My name's Alana, and I'm the Partnership Manager at UNE Partnerships, a nationally registered training organisation within the University of New England. Thank you for joining us for today's Lunch and Learn session. We hope you're able to enjoy your lunch while we share some valuable insights about the Certificate 4 in Medical Practice Assisting, a qualification we are proud to offer in partnership with the Hunter New England and Central Coast PHN. In just a moment, you'll hear from Kay, our Health Training Manager at UNE Partnerships. Not only is she an exceptional leader in training and workforce development, but she brings a wealth of real-world healthcare experience, from her background as a registered nurse in midwife to her work as a clinical facilitator and her experience delivering programs and schools in overseas and Indonesia. Before I hand over, I want to highlight that the Certificate 4 in Medical Practice Assisting currently has limited smart and skilled funding available. This means that until all funded places are allocated, the qualification, which is worth $7,990, is available for a student contribution fee of just $500, thanks to the support of the PHN scholarship. As without this scholarship, as students, you could potentially be paying student fees of between $2,000 and $2,500. This presents exceptional opportunity for anyone who has been considering this pathway. Now, it's my pleasure to hand over to Kay, who will take you through the details of the Certificate 4 in Medical Practice Assisting.
Well, thanks, Alana, and yes, good afternoon, everybody. So I do have some slides to share with you today, and I do believe, if I'm correct, if there's any questions along the way, you can pop them into the chat. So I might get started. So yes, we're here to talk about Certificate 4 Medical Practice Assisting qualification that we offer at UNE Partnerships. So medical practice assistants, or as we abbreviate the phrase to MPAs, they certainly have an increasing role to play in practice at the moment, aiming to alleviate some of the stresses and workloads on medical practitioners and registered nurses. This is a nationally accredited course. The qualification reflects the role of the medical practice assistant, the MPA, whose work includes a broad range of administrative functions combined with tasks to support the health professionals in the delivery of care. These tasks are completed under the direct or indirect supervision of a medical practitioner. So what is an MPA? Many medical assistants or MPAs fulfill a practice management function. They can help with human resource management, handling financial accounts, rostering and office management. That's another avenue that they can complete in the workplace. But they are a member of the medical practice who are formally trained to be multi-skilled and flexible within the team. They provide administrative and clinical assistance, for example, in the treatment room for procedures to health practitioners. An MPA is a multi-skilled team member who performs tasks at the discretion of that registered health professional. You'll hear that repeated quite a bit because it's very important to understand that. So one of the things that's often discussed is that what is the actual scope of practice for a MPA? So the MPA performs delegated clinical and administrative duties, and I'm sure as we have some medical administration positions here today, you won't be a stranger to that. My apologies, I keep getting little screens over mine. They need to complete those duties within the supervising health professional's own scope of practice. So in basic terms, an MPA cannot perform a clinical or administrative task that's not already in the scope of practice of the health professional in which they're working under. Their duties need to be consistent with national and state legislation, very important, and also the healthcare practices own protocols. In addition to all of that, the MPA also has to work within the scope of practice of their own education, their own training, their own experience, and the scope of practice that's set out for them. It's important to note that MPAs are not independent practitioners and they do not make decisions regarding the care of patients. And they don't just determine any investigations to order. They do not diagnose, they do not refer or prescribe, and do not provide counselling services to patients. Okay, so what will a student learn in the Certificate for Qualification? In a broad sense, an MPA will be able to provide first aid if required. They learn about working legally and ethically with a diverse range of people. They support health professionals in the delivery of care. They communicate appropriately within the healthcare context and facilitate a coordinated approach to client care. Now, as I am aware, we have a lot of admin staff here today. So some of these administrative duties that fall under the scope of practice for an MPA, but also that we, within the units of competency within this qualification, you do further learning, are there on your screen. I won't read them all out, but you can have a bit of a look at what some of those administrative duties are. Most importantly, adhering to policy and procedure and making a contribution to policy and procedure under all of those duties is very significant. So in addition to administrative duties, also the clinical duties. And it's very important to note when you're looking through this list of clinical duties that within the scope of practice of an MPA, you are providing assistance, not actually performing the task itself. Some examples of that are, when we're coming to wound care or the application of splints and slings, you can see there, removal of sutures and clips. That is in the providing assistance scope. So it's potentially setting up a procedural trolley for the health professional to be able to perform that task. You can see there's a number of clinical measurements that you're trained to do, as well as supporting assistance with plastering, if that's something that you do in your practice, and also adhering to infection control policies and procedures in the process of. So how will a student learn the Certificate for Qualification? There are 23 units of competency. So this does run over a 2-year program. It employs a mixed delivery model. So we do have online study using our electronic course materials and assessment tasks. That's through a platform that we use called Moodle. We do have facilitator-led face-to-face workshops, and I'll talk more on those in a minute, but there are clinical skills workshops and first aid workshops. We also have educators available for your support, and you can book in with an educator online and have some one-on-one coaching via Zoom or Teams. You should be aiming to have at least approximately 15 hours per week of self-directed online learning. So the workshops that support our clinical skills and first aid, first of all, the clinical skills workshop, we cover some of the units which involve clinical measurements, taking of ECGs, sterilisation of instruments, supporting health professionals, and also a unit on confirming physical health status and supporting procedures in those areas. Now, in 2026 in New South Wales, we have clinical skills workshops at a number of different places, cities, and we do ask that they're aimed to be completed within the first 6 months of the program. And the reason for this is so the student can then put what they're learning into practice, and you have ample time to practice those skills and really obtain that skill set. So I put our months down there for our clinical skills workshops as planned for this year. So there is one in Sydney in April, Newcastle, July, and October, and Goulburn in August. Now, the reason I've put multiple cities there is because sometimes you can't attend the most local clinical skills workshop to you, but you might be able to travel and attend another one. So just to give a bit of outline there. The first aid workshops, they cover a unit on the provision of first aid, but also advanced first aid, and that does include CPR. In 2026, you can see our workshops there. We do aim to do first aid towards the end of your program. So really, you're looking at 2027 workshops in this instance, and they're yet to be released. The reason why we like that at the end of the program is so you're nice and fresh with that particular skill going into whatever role you're taking on post this. You do, I've put a little asterisk down the bottom there about meeting eligibility criteria to attend those workshops. And we do like to be clear on that. There are 2 core units of competency that we'd like you to achieve, and that's one on infection control and workplace health and safety. And we'd like to see that you're progressing through the course and are ready to attend those workshops. I have put another slide here just on pathways, which may interest some of you as well, that if you do have, you complete your certificate for medical practice assisting, that it might, you might be interested in further study, and it can provide pathways into higher qualifications, in particular Diploma of Leadership in Healthcare Practice. So that's an overview of the Certificate for Medical Practice Assisting, and I'm happy to answer any questions. Should anyone have any?
We've got Amanda in the chat there asking, when does the course start?
Course is starting week of the 13th of April.
Fantastic. If there's any other questions, guys, feel free to pop them into the chat. Happy to
I will
answer
put
them.
I will put my email in there as well if anyone wants to email me afterwards as well.
I can see a hand up. We can't unmute, but if you can type into the chat your question, that would be great, and we'll be able to answer it from there. Thank you. Can you do modules with certificates as you go? I think that is the question.
Do modules with certificates. I'm sorry, I'm not quite understanding that question. Modules with certificates.
Do you get a module per a certificate per module? Maybe is the
Oh,
question, or is it all in one?
So as you progress through the Cert 4 MPA qualification, you can at any time ask for a statement of attainment of the units that you have that you've completed, but maybe that wasn't the question.
I think potentially it could be meaning can we enroll per unit? But just for the funding side of things, it's applying to enroll into the full qualification.
Yep. Great. Is there an age limit, as in a younger or older? So do age limits apply?
No.
Absolutely not.
Fantastic.
Well, welcome.
There we go. So just to clarify, is the learning distance education or in person? Great question.
Yeah, so online learning. So if you are self-directed through each unit of competency. So if someone said modules, same sort of thing, unit of competency, each subject, each course. But as I mentioned, there are face-to-face workshops. So and there's also educator support, which can be done via Teams. So it is primarily self-directed. You do get a study schedule from UNE Partnerships, helping you and assisting you to keep your study on track. And you are allocated an educator that can provide support there as well.
Fantastic. We've got another question that says, do you know the exact dates of the in-person workshop?
Within those months, I could possibly share them with you, yes. Would it be best to get them emailed out or?
Yeah, we can do that. We've got email addresses, I believe. So yeah, we can send those out.
Or I can say them if I just don't think I have an opportunity to type into a chat. Sorry.
Oh, that's right. Do you want me to pop them in?
So yeah. So okay. So April it is out for this cohort. If we're looking at Newcastle in October, we would be looking at the 20th to the 22nd. I will just mention that workshops, they are an expression of interest. So you do put an expression of interest in to say that you'd like to attend that workshop, and then it's confirmed once registrations have been received. So,
which you can see there. I think Cheyenne's popped that in the chat. So if you'd like to submit an EOI for the current MPA scholarship round, please click here to do so. So that's a good time in there.
And first aid, yeah, so 2027 is really out. So there will be other dates released as we move forward. If you were, getting through your studies quite quickly, and can I just say that some students do actually complete their qualification a lot earlier than the time frame that it's given to complete. I will give you the date for Goulburn also, which I know could be out of the way for some students, but it is another option if they can't attend. And that's in August. That's the 12th to the 14th.
Okay.
So we do.
And then, sorry, are these dates, Kay? Are they this year?
Yes, that's this year. Yeah.
So the 12th to the 14th of, sorry, what was the month?
August.
August, fantastic.
Yep. So just remembering that clinical skills, we do like that completed in that first 6 months. In that first 6 months, with obviously some eligibility required there. But if we get more of a demand for workshops to be delivered, we can also consider that. We certainly try and do the best thing by our students in making sure that they can get to those workshops when they can. If you do miss a clinical skills workshop in the first 6 months, it's perfectly okay. We aim for the next 6 months. It'll be, we can certainly, work with that. The idea of getting in early with the clinical skills workshop, like I said, is so you can practice those skills. You don't want to be at the end of your qualification and just learning how to take a blood pressure and not getting that exposure and that consolidation of that skill set before you start as your role as an MPA.
Fantastic. Kay, we've got another question. Was there one in Newcastle in July 2026?
Was there one in
Was there, yeah, in
Oh,
Newcastle
yes,
in
there
July?
is. There
Yep.
is.
Okay.
So possible. It's Wednesday the 15th to Friday the 17th.
All right. I won't pop that in the chat just in case it doesn't go ahead.
It will go ahead because
will?
obviously we
Yep.
have other students from other cohorts that may be coming, but
Okay.
it like I mentioned about eligibility, so
Okay.
you know, it is about completing some of those core units and making sure that we're progressing through you're progressing through the course.
Fantastic.
In other words, if you've
July 17th, was
it? July, when it's the 15th to the 17th.
Oh, fantastic. I'll pop that in now. Thanks.
So just to be clear, if you're applying to do a clinical skills workshop and you haven't done any coursework, then you know, you really need to be getting in and doing something before you come. You may not be accepted if you haven't completed anything and you're wanting to come to a clinical skills workshop, because obviously we need some of that core knowledge embedded to progress.
Fantastic. Got another question. If you finish clinical skills, can you start practicing assisting before you finish the course? I think is the question.
Yes. So there are some tasks with the clinical skills that you perform that are done in simulation, so in the clinical skills workshop, and that's really important to note that clinical skills workshop is very much setting the standard that you know, is expected to perform those skills. So we do those in simulation in the workshop, and then you go back into the workplace and you continue practicing those skills. And some of those skills require more assessment from your workplace supervisor. Once they're submitted and you've completed that unit of competency, then yes, you can continue to practice those skills as delegated within the practice once you have received that completion of that unit of competency.
Fantastic. I've just popped a note in the chat there that the recording will be located on the PHN site. We'll be able to share that link with you with all that are registered once it's uploaded on a site on the PHN website. So just to answer that question, to go back over everything today, can you get a copy to watch and listen to? Yes, you will once it's uploaded on the PHN site. Fantastic. Great questions coming through, everyone. If there's any more, feel free to pop them in the chat. We've still got 7 minutes. No worries. That might be all. Was there anything else you wanted to add, Kay or Alana? Oh, the application on the website. I think the application is the EOI at the top. Would that be correct, Kay? If people want to express interest, it's the EOI at the top there.
There is an EOI, and I believe it's on the PHN website as well. So
fantastic. So we've popped that in the chat with the link a bit further up, posted by Cheyenne Moody. So feel free to click on that link there, and that will take you where you need to go. Probably a similar place is where this recording will live as well. How do you qualify for a scholarship? That's one question.
There is an active, Cheyenne's there.
Yeah, hi everyone. I believe that's more of a PHN question. So to qualify for the scholarship in itself, for the PHN is you need to be working within our PHN region, which is the Hunter New England and Central Coast regions, and it follows the local health district regions as well. And you ideally are working in practice administration as well within a medical practice.
Fantastic. Good. Just popped a little reminder there. Is there somewhere to access what units there are for this course? That's starting with the EOI, perhaps?
On our website, actually, it has it. I might just send a link directly to our the qualification from our website as well. And
Sounds
if you
great.
scroll down, it talks about the units as well. So I'll just pop that in the chat too.
Thank you. We have a question there. How many scholarships will be awarded?
So for this round, there's approximately 20 scholarships available, and a few of them have already been awarded to a couple of people.
Excellent. Sounds popular, which is great. Any other questions? We've got a few minutes left. We'll just put the evaluation in there as well. If anyone would like to complete that, they most certainly can after the event. Fantastic. Great feedback, great opportunity. Wonderful. All right. If there are any other questions, feel free to pop them in the chat now. We're getting lots of thank yous. That's fantastic. All right. Well, if we've got nothing further to add, are we right to close up a couple of minutes early, Kay, Cheyenne, and Alana? Fantastic. No worries. Well, thank you so much, everyone, for joining us today. And thank you again to Alana and Kay and to Cheyenne for that valuable information. And we will talk to you again soon. There is another session on Thursday that will be aimed at general practice management as well. So we'll see those people then. Thank you so much. Thank you for your time.